Hi guys, welcome to my practice. So I'm Dr. Joe Brown. I know you guys have seen a lot of these videos here. A lot of people have been emailing me and said, well, I'd really like to have you guys ship some supplements to us, or how do I get an appointment with you? What does your office look like? Do you have an office? Things of this nature. So just wanted to kind of give you kind of a quick tour of our office here. So this is our waiting room here. We are not the type of doctor's office where people usually spend 2 or 3 hours sitting in a waiting room. We literally have this set up just so people can kind of fill out the initial forms, so we can get your records from you, and then we literally bring you right back into the office. So go ahead and follow me here. So what I'm going to do here is I'm just going to give you kind of a quick tour here at the office. So when you come back here, what we usually do is we usually meet with people in the consultation room right from the beginning here. So come on in here with me. So when people come in here and they're doing a consultation, so we usually sit anywhere from a good hour up to 3 or 4 hours getting kind of information on kind of the case and what's going on here. You can kind of hear a little bit of music here in the background. We pretty much view it just because somebody's sick or just because somebody has something chronic going on. It doesn't mean that it has to be boring, and it doesn't mean that it has to be not fun. So we essentially try to take things serious, get to the root of the cause, what's causing the problem, and what kind of treatments we're going to do. But again, we do that in that kind of fun, uplifting mode. And so, we want to be serious, but at the same time, let's go ahead and, get people to have a good time while they're getting well, okay? So if we come to the room over here to our right here, what we got going on back here, we do a lot of our injection, a lot of our injections get mixed up here, a lot of our IV treatments, our immunotherapy, our vaccines get mixed up in here. And then if you come over here down this hallway here into this room, what you're going to see down here is this is one of our kind of physical assessment rooms here. We have one of our infrared sauna beds in this room here. Obviously a physical exam table. We do some of our physical stuff on here, our acupuncture treatments that we do. We have a bunch of hot packs and thermal packs that we use for a lot of different types of therapies here. And then what we do over here, kind of behind the door here, if you kind of want to follow me over here to the other side, is this is kind of where we do our alkaline water. We discuss some of our pH water testing and get people on a good alkaline water type of diet here. So go ahead and come down the hall with me here. If you move down the hall to the other side of the office here, we have another consultation room in here and another physical exam room in here. So again, more physical exam stuff in here. We have a 3-dome infrared sauna bed in here. And so what we do here, we use this for people who they need to lose some weight. They're not exercising. We want to really get them to sweat and get a lot of their toxins out. I've actually had this in a couple of videos previously. What this is this is a far infrared bed here. And this brown area in the back here, these are actually crystals. And so what we do is we have people lay down in the bed, and we usually leave them in there from anywhere from 15-20 minutes upwards towards 50 minutes to an hour or so. And this brown area back in here are crystals. And what those crystals do is they emit a far infrared light, okay? And so what that does is it causes vasodilation of the arteries and veins and of the initial topical area of the skin. It's going to increase blood flow, and it's going to get people a good sweat. So if people are going through cancer, if they're going through certain chronic conditions, they want to lose weight, they kind of need to get a good detox going on, we use this bed quite frequently for that, as well as some acupuncture and some different other things. So now if you guys follow me into this room here, different kind of checkups and stuff like that. Our office managers are here, our nurses do some of our work here. And then when you kind of come into this room here is where we have our people sitting doing a bunch of our IV therapy, our immunotherapy. We typically have 4 or 5 chairs going at any given time. So what we want to do here is we bring people into this room. We're doing IV treatments, we're doing immunoinjections, glutathione injections, a bunch of different types of IV therapies. We have anywhere from probably 10, 12, 15 different main IV therapies that we do. So wanted to just kind of give you a quick synopsis of what our office looks like. We kind of cram into here where we kind of got a lot of things going on. Our nurses are kind of here, our Maggie's here, myself's here. There's a lot of things going on at one time here, but everybody kind of makes things work.